Chapter 16, Program Management, Sandra Monk. The steps to program management consist of assessing, planning, implementing, and evaluating a program, just like the nursing process. And planning and evaluation are essential elements of program management, and they're actually vital to the survival of the nursing discipline in healthcare delivery. Now, some definitions, as we always start off with definitions and also some of the goals of program planning. The ultimate goal of a program planning is to ensure healthcare services are acceptable, equal, effective, and efficient. And I underlined that or made that bold because that is very, very important. And, we always talk about how that, we have shared resources available for healthcare. And so it also is ethical that we would do that we would provide programs in this manner. And program is an organized approach to meet the assessed needs of individuals, families, groups, and communities by reducing or eliminating one or more health problems. For example, immunizations. Planning is the selecting and carrying out of a series of actions to achieve stated goals. And then evaluation is as the methods are used to determine whether a service is needed or whether it's likely to be used, whether it is conducted as planned, and whether it actually helps people in need. So that's important to understand what each one of those, for the planning and the evaluation. And also just a point just to make here is when you're planning your evaluation, you do that during the planning phase so that you know what methods that you're going to use to provide your evaluation. Now, benefits of program planning focuses on the attention on what the organization and the healthcare providers are attempting to do for clients. It assists in identifying the resources and activities that are needed. It reduces role ambiguity, and it reduces uncertainty about the program environment, and it increases the abilities of the provider and the agency to cope with the external environment. You've got a united front, you know where you're going with your program, and helps the provider and the agency to anticipate events and barriers to the program implementation, or what might be a favorable condition for the program to be conducted in. And it allows for quality decisions, making better control over the actual program results and outcomes. And it allows for strategic planning. And we're going to talk a little bit more about strategic planning in another couple slides. So a definition of problem and need. A needs assessment is the initial and most critical step in planning and evaluating a health program. It is the assessment of a need. And so then you'll name the problem, you'll identify objectives and activities, and then even look for alternatives related to those objectives and activities. Evaluate problem solutions. You will choose a solution. And then the purpose of this strategic planning for public health is to match client needs, provider strengths, and agency sources. We've talked about before that, not every health department, not every state, not every community has the same services provided by public health, and that this is one of those reasons why different programs are planned and implemented in different communities. And also the community is part of that, part of that program planning as well. And MAP is mobilizing for action through planning and partnership. And we mobilize the community members and organizations, and it generates shared visions and common values, and it helps to provide a framework. And there are other frameworks that are mentioned in the book for long-range planning, and it helps to conduct the needs assessment in 4 areas. It looks at the community strengths, the local public health system, community health status, and forces of change, which are your social changes that are going on, the environment that's going on at the given time. And then implement the plan. You're planning for implementation, and evaluation should be done at the same time. And I've just already said that, but that's an important concept. Oh, why I keep doing that? Well, let's see. So, the benefits of program evaluation. It shows where the program is meeting its purpose, and it should answer, are the needs for which the program was designed, are they met? Are they being met? And are the problems it was designed to solve, are they being solved? And so that, that is what you're doing with your program evaluation. And in your program evaluation process, you want to engage your stakeholders. These are your, members of your community, other healthcare providers, other programs that you're in collaboration with. You want to describe the program, focus on the evaluation design. You want to gather credible evidence, evidence-based practice. You want to justify your conclusions, and you want to ensure use and share lessons planned. Don't know why it keeps going there. Okay. And describe the program and program evaluation, formulation of objectives. You want to specify your objectives, and you want to be specific. And to be truly effective, the program plan begins with a general program goal, and it moves on to more specific objectives that will help meet the program goal. But remember these goals, and they should be written as measurable goals. And I would expect you to be able to identify, a measurable goal if I gave you one of those. And levels of program objectives. The first level has general and broad objectives, and then it becomes more specific. And this is when we write our measurable goal. And then the circumstances under which the behavior is observed, and then the minimum acceptable standard for performance of the behavior is how that you will write your measurable goal, just like you do for any, nursing care plan. Program evaluation and sources of program evaluation. It might be through program clients. These are the most common ones. So program clients, and they would do attitude scales, and these are probably the most often used. And an example of this would be a client satisfaction survey. And then program records, they might look at clinical records, and this helps to provide the evaluator with information about care given to the client and the results of that care. So it could be concurrent care that's going on, or they may be looking back in older records. And one of the main problems with trying to, assess and also to conduct programs and also to do evaluations and to do quality assurance, which we're going to talk about in the next chapter, is the way that records are kept different ways, and that's why we're trying to get to one consistent way of maintaining records at some point in the future. And then they also, for evaluation, would look at epidemiologic data, and such as morbidity and mortality data, and also incidence and prevalence rates. Program evaluation, some of the aspects of program evaluation. Relevance is there a need for the program? And then adequacy is the program, does it address the extent of the need? And then progress is a tracking of the program activities to meet the program objectives or outcomes. And remember, we like to look at the formative and also summative evaluation of the processes. So formative, we are looking at progress or evaluation of the processes, and then when we're looking at efficiency, we're looking at the summative evaluation after the program has already been implemented. And then we look at effectiveness, the ability of the program to meet its objectives and results of the program's efforts. And we look at the impact or the long-term changes in the client population, and then sustainability. Are there enough resources, usually money, to continue the program? And this is always evaluated, and sometimes programs are not continued. And that is the end of this PowerPoint presentation.